wasn't part of Warp Speed, but that turned out to be a unfortunate misrepresentation. They are part. That's why we gave them the $1.95 billion, and it was an unfortunate mistake that they made when they said that. We will work to secure an emergency use authorization, which should be coming down extremely soon, and my administration will then coordinate the distribution of the vaccine, and it will be approved. I think, again, it will be approved very, very quickly, we hope. The average development timeline for the vaccine, including clinical tests and manufacturing, can take 8 to 12 years. Through Operation Warp Speed, we're doing it in less than 1 year. If you had a different administration with different people, what we've done would have taken, in my opinion, 3, 4, 5 years, and it would have been in the FDA forever. This is 5 times faster than the fastest prior vaccine development in history. 5 times faster. Say it again, 5 times faster. Nobody can believe it, actually. 3 other vaccines are also in the final stages of trial. They'll arrive within a few weeks, and they will also be mass-produced, and the delivery will be very rapid. We're ready to go. The vaccine will be distributed to frontline workers, the elderly, and high-risk Americans immediately. It will be a matter of weeks. Get out very, very much ahead of schedule. Any schedule that 99.98% of those under the age of 50 make a full and quick recovery. By giving the vaccine to high-risk individuals right away, we'll dramatically reduce hospitalizations and deaths. Case levels are high, but a lot of the case levels are high because of the fact that we have the best testing program anywhere in the world. We've developed the most and the best tests, and we test far more than any other country, so it shows, obviously, more cases. By vaccinating the elderly and the high risk, we will effectively end this phase of the pandemic and allow seniors to reclaim their golden years, the golden years of their lives, which is so incredible. And it's about time that they can have those golden years. Again, this process is starting right away. Millions of doses will soon be going out the door. They're all ready, waiting for that final approval. As soon as April, the vaccine will be available to the entire general population, with the exception of places like New York State, where, for political reasons, the governor decided to say, and I don't think it's good politically. I think it's very bad from a health standpoint, but he wants to take his time on the vaccine. He doesn't trust where the vaccine's coming from. These are coming from the greatest companies anywhere in the world, greatest labs in the world. But he doesn't trust the fact that it's this White House, this administration. So we won't be delivering it to New York until we have authorization to do so, and that pains me to say that. This is a very successful, amazing vaccine at 90% and more. But so the Governor Cuomo, will have to let us know when he's ready for it. Otherwise, we can't be delivering it to a state that won't be giving it to its people immediately. And I know the people of New York very well. I know they want it. So the governor will let us know when he's ready. He's had some very bad editorials recently about this statement and what's happened with respect to nursing homes and his handling of nursing homes. And I hope he doesn't handle this as badly as he's handled the nursing homes. But we're ready to provide it as soon as they let us know that they'll actually use it. And again, it's a very safe and a great vaccine. Already we have among the lowest case fatality rates, our country, anywhere in the world, the entire world, and we performed significantly better than our peer countries. As far as therapeutics are concerned, my administration's also made critical investments in therapies that have helped reduce the mortality rate by 80%. That's, to me, one of the most exciting things. It's incredible, some of the antibody vaccines and others that have come out and have really helped people. 85%. Last month, the FDA approved remdesivir, and we've secured enough remdesivir to treat 850,000 patients. My administration finalized an agreement with Eli Lilly to purchase the first doses of their antibody therapy, which shows amazing results. This treatment will be available completely free of cost to patients. 5,000 units have already been shipped, and many more are going out the door as we speak. We've also reached an agreement with AstraZeneca for the large-scale manufacturing of their antibody treatment, which is excellent. We expect to issue emergency use authorizations for a number of additional treatments in the near future. Tremendous promise, but remember the 85% number. That's an incredible number, but we have some tremendously promising drugs online and ready to come out. We have ensured that our frontline workers have all the tools they need. My administration's invoked the Defense Production Act and related authorities over 100 times and have made a historic investment into our industrial base. All states that requested PPE from the federal government have received the PPE almost immediately upon request. Every American who needed a ventilator has had access to a ventilator. Think of that. Very complicated piece of equipment, very expensive. And we haven't had one person in this whole country that has requested or needed a ventilator that hasn't had it. Every single request has been immediately filled. So that was something that was a great job. And now we're helping the rest of the world with ventilators because it's a very hard thing. We're producing them thousands of ventilators a month. The federal government has 22,000 beds immediately available for states and jurisdictions that need additional capacity. But we think that it's going to start going down, possibly very quickly. We'll see what happens. But with the vaccine, you'll see numbers going down within a matter of months, and they'll go down very rapidly. As we continue to combat the virus, our economy is rebounding far beyond any expectations. I see the stock market's up almost 400 points today again, and it's ready to break the all-time record. Our jobs records are incredible. The job numbers are incredible. In the last 6 months, we've created over 13 million jobs and slashed the unemployment rate by more than half. Last quarter, we witnessed the fastest economic growth ever recorded in the history of our country, 33.1%. It's a number that is more than double our highest. That was in 1952, and we've more than doubled it. The United States experienced the smallest economic contraction and the most rapid economic recovery of any major Western nation. We went down less and we went up more, which is quite a combination of facts. While healthy Americans have gone back to work and to school, we continue to spare no expense to protect the elderly and the vulnerable. According to some estimates, a national lockdown costs $50 billion a day and hundreds of thousands of jobs every single day. Ideally, we won't go to a lockdown. I will not go. This administration will not be going to a lockdown. Hopefully, whatever happens in the future, who knows which administration it will be. I guess time will tell. But I can tell you this administration will not go to a lockdown. There won't be necessity. Lockdowns cost lives, and they cost a lot of problems. The cure cannot be, you got to remember, cannot be worse than the problem itself. And I've said it.
President Trump in the Rose Garden briefing reporters on the status of operations to get a working vaccine. The president talking about case levels, acknowledging they're going up. We have seen the president in a significant amount of time as he continues to dispute the outcome of the election. Let me go to NBC's Kelly O'Donnell right now, who can kind of frame this a bit for us. Kelly?
Well, this is notable, Lester, because the president, who is so front and center and in the years of his administration, has been out of public view except for a couple of appearances over the last 10 days. So this appearance in the Rose Garden is notable for that. He is giving sort of his own highlight list of accomplishments that he sees his administration has made with respect to vaccines and therapeutics. There's lots of criticism of his handling of the COVID pandemic overall. He has not yet addressed his prospects for trying to litigate the election that has been called for President-elect Joe Biden. This is the president's opportunity to take questions if he chooses to do that. At this point, he has been trying to send the message that vaccines are coming without directly addressing the enormous spike in hospitalizations and cases around the country. Lester?
Yeah, the president noting Operation Warp Speed and talking about that announcement recently from Pfizer that it had a candidate they believe was better than 90% effective. It has not received emergency use authorization from the FDA and was not necessarily a direct part of Operation Warp Speed, in that the U.S. government did not fund the research but did make an advance payment on doses should it prove to be effective. I want to bring in medical correspondent Dr. John Torres right now. We heard the president once again say we're seeing a lot of cases because there's a lot of testing. Can you put this in perspective for us?
And we are certainly seeing more cases because the testing numbers are going up, which means case numbers are going up as well. But that's only part of the story. We're also seeing higher hospital admissions. We're seeing higher death rates as well. And that positivity rate keeps climbing. And so when you talk about tests being part of the equation, they're only a small part of it. These are actual true numbers that are happening. And we knew this would happen coming to wintertime. We're not quite there yet during our holiday season travel time. But once we hit that, we think the numbers are going to be even higher. And we'd expect about 100,000 cases a day. We're looking at 150, 160,000 cases a day now. That is not testing, Lester. Those are actual cases.
All right, Dr. John, thank you. Kristen Welker is with President-elect Biden in Wilmington, Delaware. Have we heard from the Biden camp about the status of COVID?
Well, we know that President-elect Joe Biden was briefed on the status of the vaccine today and on COVID. And of course, he has made fighting COVID the key issue. Of course, on his first day of this week, his first working week as president-elect, he announced a 12-member task force to address the COVID crisis. We also know that his transition team has been working to try to determine and plan a rollout of the vaccine once he is in office. And part of that, Lester, is because right now, because President Trump is refusing to concede the election, because his administration is refusing to give the Biden transition team key resources as well as key intelligence briefings and otherwise, the Biden team has been left in the dark as it relates to the plans moving forward for the vaccine distribution and for combating COVID writ large. So I can tell you that inside the Biden's transition team, there is growing concern about the fact that President Trump has not acknowledged the reality of this election. And there you heard him speaking from the Rose Garden for the first time in a week and still not acknowledging the fact that President-elect Biden has won the election. Lester?
All right. One other thing worth noting from the president's remarks was with regard to New York. He said the government would not be shipping a vaccine should one be approved to New York right away. As you may know, Governor Cuomo in New York and the president have had an ongoing war of words. We're going to return you to regular programming. I'm Lester Holt in New York. I'll see you a bit later on NBC Nightly News. Until then, so long, everyone.
And we are back with you at 30 Rock as News 4 at 4 o'clock continues. We did also take note of the president's reference to New York State. Governor Cuomo has been on record saying he did not trust the Trump administration's handling of the vaccine.